paper.
Yes, good morning, everybody. I'll just start sharing my screen. So is it visible?
Yes, it's visible.
Okay. So today I'm presenting a case to signify the structural and functional outcome of scleral patch graft for anterior staphyloma in case of rhinosporidiosis. So rhinosporidiosis is a chronic granulomatous infection which manifests as vascular soft polyploidal pediculated or sessile mass in the eye. Conjunctiva and lacrimal sac are the most commonly involved areas, and ocular involvement is seen in around 15% of the cases. The causative organism Rhinosporidium seaberi lives in ponds and lakes and infects the nasal and oral cavities in humans. Coming to our case, a 20-year-old female with no contributory medical illness presented with a mass in the left eye, gradually increasing in size since the last 2 years, and gradual diminution of vision since the last 2 years. There's past history of excision of mass from conjunctiva, in the same eye 16 years back. There's history of frequently bathing in public ponds which are frequented by cattle. And there is no history of any recurrent attacks of pain, redness, watering, diplopia, or as such. The best corrected visual acuity in the left eye was 20/2000 with restriction of extraocular movement superiorly and hypertropia. Superiorly, there was ciliary staphyloma measuring 11×9×4 millimeters, and the overlying conjunctiva showed a sessile mass with multiple pale yellowish-white dots over it. Superior limbus of the was also involved, and choroidal folds were seen in the fundus. The eye was hypotenuse with a pressure of 8.5 millimeters of mercury. NLD was patent, and right eye examination was normal. ENT consultation was done, which was normal, and autoimmunity was also ruled out. Coming to the diagnosis, we diagnosed the case as ocular rhinosporidiosis. We did a conjunctival biopsy and histopathological examination, which showed thick-walled sporangia of large size with mixed inflammation. And we planned a complete excision of the conjunctival mass with tectonic scleral patch graft. Intraoperatively, the conjunctival excision was done, a fornix-based flap was raised, and a 13×11 mm scleral graft was placed. It was slightly flanged over the superior cornea. Over that, we loosened the conjunctival and the hooding was done using 80 Vicryl. Post-operatively, topical prednisolone antibiotics and cycloplegics were given. In this, additionally, oral dapsone 100 mg for 6 days in a week for 6 months was given. On a third-month review, there was satisfactory cosmosis with BCVA of 20/125 and resolution of the choroidal folds was noted. Coming to the discussion, Rhinosporidium seaberi is generally acquired by bathing in ponds contaminated by animal feces in warmer climates. And the in vitro production of extracellular proteases and lipases has been postulated to play a role in limited virulence of these organisms. Now, this release from the overlying conjunctiva might be responsible for the scleral ectasia that we saw in this patient. And over the years, many things like facial atta, cartilage, etc. have been tried for patch grafts. We decided to use the donor sclera for its strength, easy handling, and ready uptake by the host. And with little inflammatory reaction and rare rejections, avascularity of the graft may lead to necrosis, and if it is not firmly secured, then endophthalmitis may occur. That is why we hooded with the conjunctiva. Amniotic membranes can also be used in such cases. Thus, we took the decision of hooding with conjunctiva in our case. To conclude, we recommend the use of donor scleral patch graft with conjunctival hooding as a method to preserve the structural and functional integrity of eyes with large anterior staphyloma secondary to rhinosporidiosis. Thank you.
That was a great presentation. And I request some of our panelists, if you have any questions to her.
This scleral patch graft, how much is the follow-up? How long it was?
We have a 10-month follow-up for the patient. Yeah.
So because there was some problems. So how many cases you had this rhinosporidiosis?
No, so rhinosporidiosis, we have a lot of cases because this is an
endemic. With this scleral patch graft.
Only one. This is the only case that we did for patch grafting, the one which presented with staphyloma.
Okay.
And we had a good result.